new attendees, if you could introduce yourself and tell us a little bit about you. We'll start with you, Sydney.
Hi, I'm Sydney. I work for Oxford House Inc. I am the outreach representative for Clackamas County. If you're not familiar with Oxford, we are a clean and sober home environment housing. And I just came across this meeting today, and I wanted to see if we can support in any way.
Awesome. Welcome.
Thank you.
We're taking small donations from new members to participate in our program. So we'll be putting up. I'm kidding. Sorry, couldn't resist.
You got me. I was like, okay.
Okay. Any other newbies?
Hi, everyone. My name is Claire Rojal. I am the Addictions Prevention Coordinator for Multnomah County. So I oversee our alcohol and drug prevention education program and our problem gambling prevention program, as well as our Drug-Free Communities Coalition, one of them within our county. So that's me. I'm excited to be here today.
Awesome. We're excited to have you. Welcome.
It would be really great if I could get the contact information for the Multnomah County young woman that just spoke.
Absolutely. I'm happy to share it.
I'm Don Mazziotti and a member of the commission. My email is don@donmazziotti.com.
Claire, if you either put into the chat your email, we'll make sure Don gets, because he's on the phone, so I don't think he'll have access to the chat.
No, I don't.
Okay.
Sorry.
No worries. We'll get you that connection.
Thanks, Doctor.
Of course. Reggie's fine. Hey, Chris, you want to say who you are?
I will, yes, thank you. My name is Chris Gibson. I'm the Executive Director of the Oregon-Idaho High-Intensity Drug Trafficking Area Program, which is a counter-drug coordination grant that operates in, 12 counties in Oregon and 4 in Idaho now. I'll just disclose, we're primarily an enforcement grant, but we also are very supportive of and actually financially supporting several different prevention groups that are scattered throughout the region. And actually one of my primary interests in my job is supporting the prevention side.
Awesome. Welcome. Any other?
Mark
Van.
You want to say who you are?
Sure. My name is Mark Van Ryzen. I'm a research professor at the University of Oregon, and my specialty is school-based prevention for substance use, mental health, bullying, and other behavioral problems. And Tony's a colleague of mine. He suggested I attend and get involved in the discussion.
Ooh, welcome. We're glad to have you.
Thank you.
Awesome.
Sorry, I still don't see Dr. Biglin.
I don't either.
I'm going to reach out to him.
Okay. Well, we're going to, Pam, if you are ready, if we can move up your section of the meeting today.
Sure. Can you give me, like, share screen?
You have the ability to share your screen. Just push the arrow that points up next to the leave button.
Sure, it's trying to do something to my system about recording.
It's what?
I am muted.
It's doing, can you hear me?
Yes.
When I click on open share, it's telling me something about my system. and I'm tech challenged. So
Saying something about the meeting being recorded. This is Heather, by the way. It's because I'm recording the meeting to put on our website afterwards. So I'm not sure if that's the message you're getting or not.
yeah, it's interesting. Okay.
Well, if
I apologize. It's like
it's okay.
Pam, can you email me your slides and I can try to share
Sure.
them?
Yep.
Hey, Heather, Tony's having trouble getting in. Can you send him the link again?
Yes, I will.
Thank you. Hey, Tori, can you just say who is all in attendance for the new people so they get a sense of who
Yeah, of course.
is on for the people they can't see? And you did send it to me, right, Pam?
Yep. I just sent you an email.
Okay. Thank you.
So thank you guys for the new folks for introducing yourselves. If I could have our regular prevention people do a very brief introduction of yourself, and we'll start with you, Dwight.
Hi, folks. My name is Dwight Holton. I run a nonprofit called Lines for Life. We do substance abuse and suicide prevention and promotion of mental wellness. And it's nice to see so many familiar faces here. Hi, Pam.
Thank you, Dwight. Tatiana, if you could do a brief introduction of yourself.
Hello, everybody. Calling in by phone, transitioning between the bus and my house. I'll be back to my laptop shortly, but I'm Tatiana Director, and I'm the interim section manager for the Health Promotion Chronic Disease Prevention section in the Public Health Division. And then we'll be heading back to my regular job in a few months as the Alcohol and Other Drug Services Manager. So looking forward to working with you all.
Thank you, Tatiana. Thank you for being here. Dr. Richardson?
Hi, I'm Reginald Richardson. I'm the director of the Alcohol and Drug Policy Commission.
Awesome. Jill?
Hi, I'm Jill Gray. I'm one of the analysts for the Alcohol and Drug Policy Commission, and I'm here to support Tori and Dr. Richardson with the Prevention Subcommittee.
Thank you. I'm Tori Algie. I'm also a staff with the Alcohol and Drug Policy Commission. My title is Senior Analyst. Thank you all again for being here. Who did I miss? Jessica?
I haven't gone.
Pam?
Pam Pierce. I'm the Executive Director of Community Living Above, which is a substance use and high-risk behavior prevention organization. And I'm also one of the co-founders of Harmony Academy, which is the recovery high school. And I also opened up an alternative peer group, and that has since become an initiative of Madrona Recovery.
Wow.
Hello.
Thank you for all the work you do. Jessica?
Hi, I'm Jessica Krantz. I'm an associate professor in the Department of Counseling, Psychology, and Human Services in the College of Education at the University of Oregon. And my research and clinical practice focuses on college student and other young adult drinking prevention. So I'm very happy to contribute that knowledge to the group.
Thank you, Jessica. Caroline, if you would give us a brief description of who you are for the people who don't know.
Everyone. Sorry, I'm multitasking for a few minutes here, but I'm Caroline Cruz, Confederate Tribes of Warren Springs Health and Human Services General Manager. So welcome, everyone.
Thank you. All right, Don Mazziotti.
Don Mazziotti. I'm co-founder of Oregon Harbor of Hope, and now working for another nonprofit just formed called Frontline Services in Portland, working to do direct mental health and substance abuse disorder assistance on the streets.
Awesome, awesome. And we have someone that just called in from a 541 number. Will you please introduce yourself?
Yes, my name is Anthony Biglin. I am the chairman of this committee, and I can't get into the call. And Reginald said he was going to send me a link, but I haven't received it yet. I tried the one that was in the agenda repeatedly and never got in. So.
Well, it's been sent again because I got the forwarding notification. So it's been sent.
It's also in the calendar invite. At least that's what I use.
Let me try that.
Anyway, so, hold on a second, Tony. Pam, I finally received the email you have, so I'm ready. It's a 15-page document, correct?
Yeah, it's big. It's big. And I'm going to apologize before we look at it.
All right, I'm ready when you are. Maybe. I hope.
So I'll just kind of preface before we jump into this document. I started in this work probably 6 years ago, and I did so because I'm a person in recovery, and I wanted to be able to share the message that prevention, if it's predictable, it's preventable. And so knowing that the substance use disorders are an animal that are, we can't pin down, if we understood it, if we understood the risk and protective factors, and we could cover, throw out a wide net, how could we help young people? I always say, and it's kind of a weird thing to say, but that they get to use. Eventually they get to, if they can just delay use. And so how do we explain that to them, and how do we give them the support and create a new story and change the social norms that we've put together? And again, just being a person in recovery with an interest and a passion to want to spread the message to as many people as I can, I jumped in an arena that I'm still learning. The different ways that prevention organizations get funded and who they work for, who they represent. It's like this massive web. And because I have ADD, it's been very difficult for me to sit and understand. And because to be honest with you, I don't care. I just want to get over the wall. But the document that you're about to see, most people probably won't understand it, but I had to put in a way that I could start to kind of pull things apart. It's like, how does this state work? And one of the things, and again, this is from a lay perspective, one of the things I've noticed in working in this arena in Oregon, things are very siloed. And there are a lot of people doing a lot of really good things, but I don't know that people are aware of it. And so I started to build kind of an org chart, although it's a Word document, to try to understand, how does this work? How does the federal government talk to OHA, who talks to, and I actually have a small org chart that I didn't forward on, but how does the federal government talk to OHA? How does OHA work in the prevention arena, defined the way that we're going to define it? I've sat in many meetings recently where when the words prevention are used, we're talking harm reduction. Well, I'm not talking harm reduction. I'm talking about preventing it from beginning to start with. And so again, from the federal government down to OHA, how does OHA talk to the rest of the state with regard to their programs and their divisions? And a lot of those, at least how I interpret it, there's a lot of crossover and cross section, but again, it's trying to understand what everyone is doing. And those programs, do they go down into schools? Are they mandated to do so? One of the things that, with regard to schools, it's all about, everyone talks about collecting data, evidence-based, blah, blah, blah. Well, the only data that is collected is through the Oregon Health, the Oregon Wellness Survey, and it's not mandatory. I mean, I've been fighting my school district for forever. And so it's things like that. It's trying to identify how did that get created. And I think Dr. Bigland said that he created the survey. But again, it's understanding who does it, who doesn't. The Justice Department, how do they work with prevention and the healthcare systems and law enforcement? And so this big document kind of looks at OHA and all the various things that have been done. And this is a work in progress. And I would like, I'm sure there are people on this call that have a lot more knowledge than I do. And I'd love input, but it's a huge web, and I'm trying to figure it out. How does funding work? Where do the taxes go? And it's not so much as, oh, look, you're doing good or bad work. It's just trying to understand what is happening so that we can talk to each other, so that we can share resources and get this done as fast as possible.
I ask you, Pam, to present on this because it seems to me that what you're struggling with is the same thing that we're all struggling with, which is to get our arms around what is happening in the way of prevention and how is that organized, and are there ways that we could contribute to it being better organized and more effective. And I have a list of organizations that we have talked to. So I think maybe one of the things we could do would be to have at least a couple of volunteers from the committee review what you've got. But I think it has to be compared with what Dr. Richardson and others are aware of and are working on in terms of what OHA is funding and where that funding is going to communities, and what other entities in the state are doing things relevant to prevention.
So the list that we put together when we first got together that I sent you, Tori, there's 66 organizations. What I've done on that, I'm going to create like a survey monkey, and I'm going to ask them, tell me what programs you're doing, who you serve, and how you get funded. And I'm just going to upload it on that document. Because again, OHA is a massive, again, a web. Well, but I think if we get that information from those people, letting them know why we're asking for the information, we can start kind of poking in there and seeing what schools get served and how, and see if we can duplicate it.
Okay, so can we get other people's input on this? I think this is to an extent duplicative of what staff are trying to do already. Yeah. Dr. Richardson, would you, do you have thoughts about it? And then we'll ask other people in the committee.
Thanks. So I think Pam has identified something that we've talked about quite a bit in our general commission meetings, is sort of being able to follow where the money is. I know that's a big thing that Dwight has talked about, and it has been a huge challenge in trying to do that. We even participated in a program with the National Governors Association trying to map some of the various areas that we interface. So there are 13 state agencies that are responsible to some level of SUD funding and services. There is a ongoing study done by Oregon Health Sciences University who are attempting to do a inventory of the services that exist in our state, and then making some population guesses about what will be needed in the future. So it looks at where we are today, where we are going to be tomorrow and in the near future, and then what should a right size system look like? How many of these various things do we need in order to have the continuum of care across every county? And we're not looking to get the results of that probably until the summer. There's also another study that came out of House Bill 5006. There's a budget note that orders the Oregon Health Authority to do a similar thing, but to do it as it relates to current funding, potential revenue, and to what degree are state agencies, programs, and funding commiserate to the objectives of the state plan, and that's not going to be done until August of 2022. So there are these pieces that are in place, but I think what Pam has identified and what others have identified is the need to have this critical information of understanding what our system is. And we currently, today, we have great pieces parts, but we don't have a comprehensive, integrated, coordinated system yet.
Can I make a up to discussion?
Sure. If you're talking, we can't hear you.
Dr. Richardson, I have a question. At
Sure,
the
go
very
ahead.
end of my document, there's a
You want me to pull that up?
I mean, you don't have to, because this is just something, but at the very end of that document, it looks like, and this has something to do with ADPEP or whatever the acronym is, but it looks like there was an organization hired to look at, I'm trying to get to it. And there was a timeline that was created by OHA that had to do with prevention. Alcohol and other drug prevention across OHA timeline on page 10. And then there was a report created by an organization called, and this is all on OHA's website, Coraggio Group. Am I pronouncing it right? Oregon Health Authority Public Health Division, Health Promotion and Chronic Disease Prevention, June 16th, 2017.
Yep.
What is that?
So we have a representative from Public Health. Tatiana, can you unmute? Are you with us? Can you help us understand what that is?
Yep, and I'm standing right by the train, so hopefully this won't be too loud and distracting. So I believe that report is from a number of years ago, and certainly Carolyn can also speak to this. When a portion of funding, there are multiple funding streams that support substance use prevention work across OHA, but one of the key funding streams at that time lived in the Health Systems Division, Behavioral Health Teams. And at that time, there was a decision to move that funding over into public health. That was a really challenging time for the prevention system because of that change. A lot of concern about how that transition happened. And the Coraggio report was one way that OHA, tried to reach out to community partners to get more input. Ideally that should have happened before the transfer, but unfortunately it didn't, so it happened afterwards. And so that report summarizes some of the key findings that the prevention community at that time said as either needs or gaps in the system, concerns about their infrastructure, the ability to train and support the workforce, and then those missed opportunities for coordination. So that is that report. Carolyn, do you want to add anything to that?
So yes, in I believe it was 2015 when Lynn Saxton was put over the Oregon Health Authority. I'm not really sure as to the why, but there was a decision made to transfer the alcohol and the Addictions and Mental Health Division was split up. Prevention was moved to the Oregon Health Authority underneath Public Health. The mental health and the treatment stayed with what they then determined to be called the health system. There was a lot of folks within the prevention field who were totally against the move, but nothing was done about it. So when all the complaints came in, and Lynn Saxton was no longer there, and there was a couple of other leaders there before Pat Allen. So there was a decision made to hire this consulting group to do a series of meetings throughout the state to get feedback from the prevention field. So I attended the meetings that were held in Eugene. And so we were asked a series of questions, brainstorm groups, and all our information was put into this report. I'm going to be quite honest, I never saw the final report. But what was more frustrating, after the report was done, nothing came out of the report. And so it just created more frustration within the prevention field. So we're talking about 6 years now, close to 7, it'll be 7 years now in 2022, where the prevention field doesn't feel like they have strong leadership in terms of the way they were trained in order to do the prevention science, in terms of the certification process. That has several domains in terms of it has to be mastered in order to be a prevention specialist or be a certified prevention specialist. So because of some budget cuts within the state system, some of the things that used to be done in terms of having, I believe there was at least 2 meetings per year where the county prevention coordinators or specialists would come together and they would brainstorm, they would learn from each other, they would bring in the latest information around the field, and then there'll be some prevention planning around that. So slowly over the last 6-7 years, that faded away to the point where there was very little, meeting with the different coordinators, and they used to depend on each other. They used to come together in order to do planning to share. So the only group that has continued on and continued meeting on a quarterly basis has been the tribes. And so as a result, the tribes, we are meeting consistently, and we continue to promote the prevention science the way it was designed before, and we continue to move forward. Of course, COVID came in between and stopped everything, but we continue to master the virtual trainings, and so the tribes continue to meet. So there's a lot of frustration, I think, for the people in the field, thinking that once that report came out, that there was going to be some major decisions made on the results, and that didn't occur. So
can you hear me now? Can you hear me now?
Yes,
Yep.
we can hear you now. Thank you, Caroline, for that, for the background and for giving us a well-rounded view of that report. Thank you. Always good to have someone with that scope of knowledge. So we appreciate you, Caroline.
Jump in really quick. Caroline, I'll send you this document that I have. and honestly, it's like I couldn't even tell you off the top of my head where I found it. So, but I'll send it to you. Maybe what you're describing is here, and it just never got out.
I'd like to move the agenda around a bit. It seemed to me that in the last meeting, Dwight suggested we discussed the history that Carolyn just went over, and said that we needed to get with the counties about their prevention, what the prevention situation is now. I've talked to public health directors in 2 counties who said that the money flowing from OHA is going to them, but one of them told me this morning that other counties are apparently funneling some of that money not to public health, but to mental health, a different entity in those counties. But I think that the discussion that came out of the last meeting was that that there was going to be an effort to convene people, and I was hoping that Dr. Richardson could describe where we're at with that. And this is item 5 on the agenda, which is all of the statewide organizations. Who are they, and how do we relate to them? Is it acceptable if I ask you that?
Sure.
You already have. Tori, you want to talk about where we are?
Sure. So we've started collecting the names of people or organizations who we'd like to participate in our symposium. We have a date. We're targeting to have the symposium by the end of January. So we are not going to stretch this out. We're going to do this timely and soon. And so we've been partnering, or I've been partnering with Healthy Together Oregon, because they've done symposiums virtually and can help us ensure we have it on the best platform, things of that nature. So that's what we're in the process now, finding the best platform in which to build this on, and then we'll send out the invitations for people to sign up and then participate.
Do you have a list of the organizations?
You've also collected names from participants in this group, and others, our partners at OHA, particularly in public health, have shared their folks who they believe should be involved. And so it's pulling together the list of county folks, state folks who can participate, including practitioners who are on the ground doing this work.
Correct.
And Tori, you mentioned other state organizations, and could we get a list of what those organizations are? I'm particularly interested in having University of Oregon prevention program involved, since I think we want to draw them into making sure that their work is actually serving the needs of the state. And I think there's training to be done and research to be done that they could contribute.
Okay. Well, yeah, definitely I am compiling the list. I don't know if you guys remember, at the end of our last meeting, I sent out an email asking if you had some names to please provide them. The opportunity is still there. So if there's people or organizations that you've identified that you'd like invited, feel free to email me the contact information or the name of the organizations.
Okay, I'll put that on my to-do list.
Great.
So where are we with the agenda then? Have we dealt with number 5 in that regard?
We just did. The only thing we've pushed up is Pam's presentation.
Okay. Well, no, actually, it's number. Well, in some ways, to me, we've dealt with both number 3 and number 5. You've talked about the planning for the meetings of county level stakeholders, though I think it's a broader group than simply county level stakeholders. Is that a fair statement?
Yes,
okay.
Definitely.
And then the prevention relevant statewide organizations, I wanted to give you a little information about some of the contacts I've had. I don't know if they're on the call, but there are 2 graduate students at the University of Oregon in the prevention program who have volunteered to help us with this. Their skills are in prevention and also in data collection and analysis. And I think I had talked to Dr. Richardson about the possibility that they might help with an issue of getting on top of what can be done to reduce youth access to substances. That's one thing they could do, but there are others, so that if we have needs that have to do with surveying systems, that kind of thing, or reviewing research and giving us summaries of that research, that's another thing that they can do. I don't know if they're on the call or not. Their names are Sean Austin and Jason Small. So that's, I guess that this is an FYI, except I wonder if people have ideas for how we could use that resource, what things we want to accomplish that we might not be able to accomplish with our committee members and staff. Anybody have any comments? Okay. If not, then we will go on. Okay, so what I wanted to do with that second item is explore the possibility that we should try to articulate the power of prevention in a way that enables us to influence a much broader swath of Oregonians to understand what prevention is about and to be supportive of it. And one of the things that I keep saying is that, and this is the complexity that I was trying to talk about earlier when you couldn't hear me, that when it comes to prevention, the prevention of substance use requires us to focus on all kinds of things that aren't labeled substance use, that say nothing about substance use, but rather ensure that kids develop the skills that they need to succeed in school, to succeed socially, to not be rejected, to overcome trauma. And that requires, both families and schools to become more nurturing. And so it seems to me that it would be useful for us to discuss whether we should try to come up with a sort of an elevator speech and maybe a 2-page document that that say what we're talking about, and it's something that could be developed not simply by us, but in conversations with the other people that we're talking about. My nonprofit Values to Action has gotten some skill in developing those kinds of things and in using social media. And I think the fact of the matter is that so far as I know, this is the only entity that's dealing with prevention in the state. And I think as a necessity for affecting substance use, it needs to be addressing all of the factors that affect substance use. And that means things, starting with prenatal care. So I think I'll be quiet, but I'd just like people to give their thoughts about that. And I have my packed sticks, if you recall, so everybody gets to talk. And if nobody volunteers, I'm going to start using packed sticks. Reginald's moving his lips.
It looks, no, go ahead, Pam. Go ahead.
No, I was going to say, Tony, I like that because again, it goes back to the very first thing I wrote on my org chart was defining what this is so that everyone understands. And I agree, like looking at all the protective factors, if we could just, just make it simple, but yes, in one document, be able to say, this is what we're focused on. And then the action. How do we do it?
Thank you. Tatiana, are you far enough from the crane that you
Yeah,
can talk?
I am here. Sorry, little drama. I just had my bag stolen while I was waiting at the bus stop, so I apologize. I had to go looking for it, but it's not going to show up. So I'm just going to deal with it later. I just was going to say, Pam, I think that what you're describing is such great timing in many ways. That Coraggio report, even though it's a number of years old now, still is really relevant to now. You'll notice there's a lot of language in there about the different lenses that different parts of the prevention system bring and how they define it. And that's still not, I wouldn't say a tension, but it's just a need that still exists to clarify, which part of the system uses what kind of framework, and just having some shared language. So I think that's really critical. There are a couple other things that I think make the timing really good on the OHA side of things. Part of my job that I shared with you, that I'm an interim manager supporting another section right now, but the position I'm going back to was created about 18 months ago. It's called Alcohol and Other Drug Prevention Alignment Manager. And really just to capture that spirit, right, of recognizing how disjointed and siloed all this work is, and why we need to keep working to try to bring it together in a more integrated, holistic way. We've been working really hard with Dr. Richardson and his staff to try to do that at the staff level within OHA, just to get kind of our own house in order, because we're pretty siloed up and didn't have a good understanding of the system, even as staff. We've been working for about a year really trying to improve that. And I think now the timing of pivoting into our community conversations is great. And having the symposium in January just kind of be a kickoff to that, to share out some of the things that OHA has been doing at the staff level to try to create that more integrated approach, and then having that dialogue with the community. And so I know one symposium won't meet all the needs, but the timing is really good. Just to highlight what is the new work, where are those gaps, and where the community partners fit into helping us create that better system together. We also have on the public health side a new initiative called the Shared Risk and Protective Factors Initiative. It's coming out of our injury and violence prevention program. So that's where our suicide prevention, our overdose prevention, and sexual violence prevention work is happening. And we're using that as a way to get all of the sections kind of on the same place, using a more integrated shared risk and protective factors frame. So those are just a few examples. I mostly just wanted to lift them up because, again, the timing of this conversation is so great. And I think we have so much opportunity to pivot towards the future based, again, using the ADPC strategic plan as our overarching guiding framework for this work.
Let me ask you one more question on that. How well situated are you to educate the public about the importance of prevention?
Yeah, well, and just like every intervention, the way we message and communicate is also pretty siloed up and fragmented, right? And so that is another unmet need around how to have a better coordinated communications and messaging approach across OHA, not just in prevention. We have pockets of work depending on which section has what amount of funding. And we don't honestly coordinate as well as we could. And I think that is another area of need to be able to do that better together.
Okay. Dwight, would you have comments about this?
No, Tony, although I underscore, I appreciate your laser-like focus on upstream, getting us into things like the kind of resiliency building and prenatal care and support for early families, because I think we all know that it only gets more expensive and more challenging the further downstream we get.
Don Mazziotti. I guess not. Chris Gibson.
Admittedly, I'm playing catch up here and trying to get my arms around what's actually being proposed and what's needed here. I'll probably go completely off base with this, but in my experience working within our counties, the prevention efforts seem to be completely unconnected anywhere, and I think that a lot of that has to do with we really don't have a good idea of who's doing any prevention work out there other than what's right in front of us. And I know that there's a lot of good work that's going on. We actually have through our program, there's a secondary grant program that just closed out, and Oregon State University Extension put together a proposal that really proposes within our 12 HIDA counties in Oregon and 4 in Idaho to do a survey, kind of merging what's happening on the enforcement side versus what's happening on both the public and the not-for-profit side around prevention, and trying to bring those two things together under an umbrella of a bigger HIDA initiative, which is the overdose response strategy. There's a lot
Chris,
of...
I apologize. I didn't hear an introduction, and you've referred to your group and so on. Could you elaborate on that?
I'm sorry. Yeah, I'm the director of the Oregon Idaho High Intensity Drug Trafficking Area Program, which is a counter drug grant program that's funded by the White House Office of National Drug Control Policy. There's 33 different HIDAs around the country, with one in Puerto Rico, one in the U.S. Virgin Islands, and one in the District of Columbia as well. All states are represented.
I'm familiar with that. Thank you.
Okay,
Sorry
good.
to interrupt.
No, that's okay. That's perfectly good. Anyway, kind of one of the things that I know that I'm tracking on and we're trying to track on is prevention on the side of overdose reduction strategies. And we've got a public health analyst and a drug intelligence officer that work together to kind of share that information back and forth. So my entire focus is based upon that effort between enforcement or supply reduction and prevention, harm reduction and treatment as well. And one of the things that, and it may just be my ignorance on, but just really as we get farther into this, I'm just finding that it seems to be more and more disconnected, and people are off doing very similar things. Some are off doing things that aren't necessarily probably in line with what should be happening, but those are all based on opinions. And this grant kind of proposes to go out and do a literature review of what's available within the region, to do some work on bringing those things together and really getting a firm handle with the idea of writing a report and a pathway, at least for us, through this overdose response strategy effort. And again, that's just really kind of another example of how things are happening alone in a vacuum without much knowledge from anybody else.
Of the other parts.
Yeah, the other parts.
Dr. Richardson, you have your hand up, so to speak.
Yeah, it occurred to me that perhaps we should just take a moment to level set a little bit and to remind, since it's been a while since this larger group has met, as to how we got here, and your recommendation, Tony, to expand a little bit. I'd like to just go back and remind folks what we agreed when we met back in September. So if I could just take that liberty to just share my screen real quickly. If you remember from our strategic plan, these priority areas we identified in the prevention part of the strategic plan. I hope everybody can see my screen. These 6 areas, and I believe that Dwight added a 7th one, and we agreed to it, and that was the convening of the prevention community based on the history that Pam and Caroline just gave about what happened to prevention in our state system. Tori and myself and my staff agreed to take the lead on that particular priority of convening the prevention community, which you heard Tori talk about we're going to do in January. And then we've been having several meetings with item number 6, which really address the family risk and protective factors. And several of us are on that work group. And so those are the two major areas that we agreed to work on and to try to gain some traction. So although all the things that Tony, that you've talked about that we definitely should be doing, I'm a little concerned by mission creep a little bit, and that I don't want us to expand more than we have the capacity really to handle. And so I just wanted to remind folks, particularly our newer folks, that that's where we are right now. Now, if the majority of you say, no, we really ought to do a lot more, then, we'll have to do that. But I'm just concerned about the capacity that we currently have in staff and volunteer time. Thank you.
Tony,
Two things come to. Yep. Don, go ahead.
Yeah, sorry, I somehow dropped this call. I apologize. No, you were asking for my observation. I'll do it very quickly. Listening to the discussion is extremely helpful, and it seems obvious given the fragmentation of silos, et cetera, that everyone seems to acknowledge, and that seems to be the case in terms of distribution of funds and programs. Is there a statewide organization dedicated to prevention that has some sort of overarching strategy, or does that not exist as it is not a typical reimbursement line? That's kind of a question I have.
Well, it strikes me that, I don't know, I guess I've always felt that whatever committee I was on, that's where the revolution should begin. But I think that there's a sense in which what we need is a unifying understanding of prevention, even though all of that may do is provide a framework within which we could begin to get these silos working together. So I don't think that there would take a lot to do that. But we have a big
Tony, I agree. I agree, Tony, completely. We've got to define what we mean by prevention, and then begin to say, here are a couple of targets that are in alignment with the Commission's direction in the strategic plan work that Dr. Richardson just outlined.
Jessica.
I believe Caroline had her hand up.
Oh, I'm sorry.
Yeah, go ahead, Caroline.
So thank you, Tony, for bringing back up the goal. Bring that back up. But my frustration and is the fact that we have all these darn walls with no foundation. We don't have anything holding us up. And over the last 6 years, that has disappeared because of different approaches. So when we had the Addictions and Mental Health Division, there was a solid foundation in terms of how the Addictions and Mental Health Division was leading the state when it came to prevention. I still have the last prevention manual that actually might be helpful for all of us in order to see how it was done. I also know that 6-7 years have passed, and it's better for us to, instead of reinventing the wheel, to look at what was and see how we could strengthen that with the information or science that we have now. But again, we could talk about all those 6. I think the 7th one, according to my notes, is bringing prevention world together. That was the 7th one that was added. And so in order for us to do this, we're not on the same page. And I think this is the intent of us all coming to work together. So Dr. Richardson, I'll send you the latest manual, and then you can send it to whoever needs, because I think we need at least something that was, because public health had a different focus, a different direction that was foreign to a lot of people who were in the field at that time. And that was never resolved. It was never resolved over the last 6-7 years. It doesn't mean that public health was wrong or the Addictions and Mental Health Division was wrong. It's just that we were never on the same page, and no one ever tried to fix that. even though many of us tried to intervene, it just wasn't a priority for some reason. And so now we're all getting our hands slapped because our numbers are still high, and we don't even know what deliverables. We have the strategic plan. We can't get there without a solid foundation. So I'll send that manual, and that might kind of help us or guide us in terms of what was.
Awesome. And thank you again for that, Caroline. And the number 7, bringing the prevention community together, is what we meant by the symposium that will happen in January. But you bring up a very good point, is we can build this definition and come together as a subcommittee in regards to what it will be. But who then do we hand it to? Who then do we influence to adopt it? Which is similar to what you were talking about happened in the past, where you found a disconnect, but it's still there. Claire, you had your hand up.
Hi, thanks. So I introduced myself earlier. For those of you that didn't hear, I'm the Multnomah County Addictions Prevention Coordinator. And along with Pam, I sit on the Oregon Public Health Association's Addiction Prevention section. And so we are both members of the executive leadership team. And we recently adopted a definition of prevention for our addiction prevention section that I'd be happy to share with this group as well, to help kind of, because I think from what I'm hearing, this is something that could be influential. And Caroline, I appreciate the older version, from before the switch in how the prevention system was kind of moved from Addictions and Mental Health to the Public Health Association. One of the things the APS section tried to do is we've been trying to broaden. This group started as the Oregon Coalition of Prevention Professionals, and it was something that started back when prevention was a tighter knit system within OHA and the Addictions and Mental Health distribution. This group kind of created so that it could do a little bit more and get into more of the realm of understanding advocacy work in terms of our policy work as a part of our prevention system and how that plays into the work that we do. And so we branched off with OPHA because they're a nonprofit organization that has a little more leeway. And in doing that, we've also been working to include more public health professionals and kind of streamline the behavioral health prevention, public health prevention, the two different, slightly different languages, but doing very similar work. So I'd be happy to share that with this group too, if you all think it would be helpful.
So what I'm hearing is that there's some feeling that there's diversity of thinking about prevention, and that it would be useful for us to come together with some sort of unified notion of what we're talking about. Is that a fair statement?
Yeah.
I will contribute 2 things to that discussion. One is, if you send me your snail mail address, I'll send you a copy of an entire book called The Nurture Effect, which summarizes what we've learned about prevention. And the other is a report by the American Academy of Social Work and Social Welfare called Unleashing the Power of Prevention, which has had a fairly strong influence on prevention thinking in a lot of places, Colorado in particular. So, Tori, what shall we conclude from this?
It sounds as though, and someone else's hand is up, but let me answer this and then I'm going to get to you, the next person whose hand's up. It sounds like our subcommittee is in agreement that we should develop a definition. It's the sense I'm getting. And it's also true. Both are true. What Dr. Richardson is saying, and it is somewhat scope creep, but now that we've learned the importance thereof, I think then we need to adopt it and allow for the scope creep this time.
Well, you know, I think if you take what Tatiana said and what Claire said, you know, other people are working on this, so it's not just our job, but if they came together with us as well, you know, they can carry some of the load, both in defining it, but also in communicating it to the people that need to be communicated it. You know, one of the things that, you know, Carolyn has mentioned from time to time is the communities that care effort, which is foundational for the prevention work that's being done in Pennsylvania and Colorado and Utah. And what that does is it has each community go through a process of organizing all the sectors of the community to understand what is needed for prevention. And I think we're going to have to get to that level so that, you know, it's not just the people working in these fields who understand this, but the community leaders in every community. But I'm talking too much, so.
Okay.
Is Tony Vizina, did the other Tony show up? He said he probably couldn't make it if he's not. How about Jessica Newworth? I think, is anybody else?
No, she's not in attendance.
Okay.
Yeah.
Tatiana's got her hand up.
Yes. Go ahead, Tatiana.
Yeah, every time I talk, I run by someone who's making a lot of noise. This time it's a leaf blower. I just wanted to just note again, the inventory, the SUD inventory that OHSU is working with Dr. Rich and his staff on as prevention staff. We've also been trying to coordinate with that project. That's an opportunity to go county by county to do a high level inventory of the resources and the capacity. And my hope is that that will also include prevention. And so I'm excited to see your initial document, Pam, because I think that's something we can use in real time and crosswalk it with that, as well as in planning the symposium. So I really appreciate all the work you put into that. And I think it's an opportunity to make sure we don't miss anybody with these upcoming inventory opportunities.
Thank you, Tatiana. Thank you for that. Okay, so now that we have agreed on possibly coming up with the universal definition, how, Tony, do you propose we move forward in doing that? Do we carve out time at our next meeting to talk through a definition together? How do you see that moving forward?
It strikes me it would be useful to have 5 or 6 people communicate between now and our next meeting to bring something to the group that, you know, had some hope of helping to solve the problem. What do you think about that? I mean, there have been 5 or 6 documents mentioned.
Yep.
That actually maybe what we should do is ask all the members of the committee to read that material and perhaps give a week before our next meeting their thoughts about how we should define prevention.
I was just thinking the same thing. If we could see Claire's and what Claire was describing, what Caroline was describing, I bet they're similar.
Okay, Dr. Richardson, your hand's up.
Yeah, 2 things. I'm going to need to go in just a second, but I want to remind us we have a definition of prevention in our strategic plan. That's the state's adopted definition for the strategic plan. That's the definition, and I would say let's not recreate the wheel. I think we should look at that, and unless there's some very, very strong argument to do something different than that definition, which has already been adopted, I would not be favor for us to move into any other definition.
Okay. What do other people think about how we should proceed?
I agree with Reggie on that point. I think we went through this back then, and I don't want to go backwards.
Yeah, Tony, I completely agree. let's stick with our definition unless it needs to be modified.
I also concur.
All right.
This is Jessica.
Well, then, do we need to do anything?
Yes, your point of making the argument for prevention, having a tight, empirically based argument for prevention, I think is still needed. I don't think we have to have a definition. We already have that, but I don't know that we all have the same talking points of why prevention is so necessary. That's the piece that you had talked about doing. And I think that still needs to be done.
Okay.
And folks, thank you so much for spending some time. I've got to run. Dwight, you do too.
Yeah, is our thing at 3? Is we got to be there at 2:45, right?
It's at 2:45. We need to be there now.
Good, thank you.
Okay. Bye.
Hey,
Thanks,
hey,
everybody.
I'll be watching and critiquing, so just to put a little pressure on.
Well, you may have looked at me and thought I needed a haircut, and in fact, I have an appointment at 3 o'clock. And so maybe we're at a point of adjourning this meeting. What do people think? I think we said that I think we said, okay, let's get clear on to-dos. I think one is we said that people are going to get a bunch of documents and they're going to read those documents, except my book, probably, and come prepared at the next meeting to try and hone a description of prevention that's consistent with the definition that we adopted and is designed to promote prevention, even to people who know nothing about prevention at the present time. Is that a reasonable paraphrase of where we're at?
I believe so, yes.
I think that's good.
Can I ask
Tony,
one question? The strategic plan that you're talking about, is that the one that's on the ADPC website?
Correct.
Okay.
Don?
Oh, I just wanted to suggest, I can't help it as a lawyer. I would like to take a look at the policy and law on the matter of prevention. I don't propose to come back with a report, but I'm certainly going to undertake that because I'm not sure we have a clear and agreed upon policy definition at the state level. So I'm going to look at that connection.
Thank you.
So I believe the Oregon administration rule, unless they modified it, it still exists. And there was definition of prevention that we used to have to follow. So I don't know if anyone updated the Oregon administration rules, but there is some prevention definitions in there.
Carolyn, was that a Department of Administrative Services directive or I'm not clear where that came from.
Well, the Oregon administration rule, I used to know all this by heart, but since I'm not working for the state any longer.
Right.
It's underneath, I think, the same definition that they use for behavioral health. And so I used to know those. I thought it was like 413 point something, but
well, I'll try to check that out.
Yeah, but there are administration rules.
Could one or the other of you get that to all the members? I mean, through Tori, get that to everybody?
The Oregon administration rules?
Yeah.
I don't know if Tatiana might have that because I think it followed them up to public health.
Okay.
I was just going to say, we can certainly, I can check with our staff and just make sure you have the most recent ones and send those to you directly or to Tori.
Send it to me, Tatiana, and I'll disperse it to the group. Thank you.
Okay, will do. Thank you, Tori.
Okay. Any other loose ends or questions we have before we adjourn?
Good meeting. Good meeting. Thank you.
So, Tori, let me get with you next week on all the things that we said everybody's going to get, just so we're clear on it.
Yes.
Okay. Good.
All right, guys.
Well-
We'll give the time. We'll adjourn a little early.
Thank you for letting me attend and sit in.
Thank
This
you
was
for
interesting.
participating. Appreciate you.
Thank you
you.
all.
Thank you. Have a great